I'm going to show you a slip disc, also known as a spondylolisthesis. In a normal spinal alignment, the front of all vertebrae are going to line up nicely, such that you should be able to draw a nice, contiguous, unbroken line from top to the bottom along the front border of all those vertebrae. In a slip disc, the joints in the back of the spine or the facets can sometimes wear out or even fracture, leading to a slipping forward or spondylolisthesis of one vertebra on another. A slip disc becomes problematic once that slip reaches a point where the nerves within the spinal canal or the nerves as they come out the foramina become pinched off. This is a side view or lateral x-ray. The patient's belly is towards the right of the screen here, and the back is towards the left of the screen over here. The patient is standing straight up and down with the feet towards the bottom. If you look at this level, there's an obvious problem. Posterior vertebral line doesn't line up, and there's a step off between the L3 and L4 vertebrae. And if you look back here, there's an obvious discontinuity of what we call the facets. This is a side view or a sagittal view of the MRI of the same patient. You can already tell the vertebrae are much better lined up, and that's because the patient is lying down and the spondylolisthesis or slip disc has shifted back into place. If you look at the L3-4 disc, you can tell there's clearly a problem here. There's less disc height, it's darker, it's lost water content, and there is a little bit of bulging in the back. This is an AP or front view of fluoroscopy or live x-ray taken during the operation. I've inserted a large spacer from the side and locked it in place with a single screw. And this is a side view of fluoroscopy taken during the operation. So I've already inserted the cage. We've reduced the spondylolisthesis. In other words, the slip disc is back to normal. The vertebral alignment is normal. I've restored disc height as well at the L3-4 space. This is a front view of the final product. And here are before and after x-rays demonstrating reduction or repositioning of that slip disc. This patient is very happy. These x-rays are taken with the patient standing up. You can see that vertebra no longer slips forward. It is fused and locked in a normal anatomic position.